What you should be doing is to stay home. Stay home, cut out anything that's non-essential, stay with your family unit. And the graphs that Meg just showed explains exactly why, because healthcare is a limited resource. And we're getting to the point where if there is even a moderate outbreak, we're not going to have nearly the supply of healthcare services. So we need to increase that supply. But what people can do every single day is to reduce the demand for that healthcare. So don't go to the ER unless you really need it. And all of us have a role to play in reducing the spread of coronavirus so that we can try to flatten that curve and prevent that escalation of cases that would overwhelm our healthcare system. So stay home. Don't transmit the virus to others. Let's stop that transmission. And that's the single most important thing that everybody can do right now.
And Dr. Wen, I totally get the point that you don't want people to unnecessarily go into healthcare units and make the pressure on them worse and spread the disease worse. What's the key factor people should look out for themselves if they are self-isolating to when you've crossed that line and you should be going to hospital?
Sure. So the key is to think about whether you would have gone to the ER if it were not for coronavirus. My colleagues in emergency medicine are telling me about how their hospitals are overwhelmed with people who want to know if they have COVID-19. And I understand their worry. The problem is the ER is not the place that you go to find out, because you're going to overburden the healthcare system and you're also going to be exposing yourself and other people unnecessarily. So if you would have gone otherwise, because you're so short of breath, you have chest pain, you have other very concerning symptoms, go to the ER, call ahead if you have symptoms so that they can prepare for your visit. But if you would have otherwise not gone, except for your concern for coronavirus, don't go, stay home, call your doctor.
So, Dr. Wen, you know, as you can see, many of us are home, working from home. There have been pretty strict and pretty robust measures put in place across the country. How do we know if we are flattening the curve and whether we're doing it in a timely manner?
That's such a great question. And the issue is that we just don't know because we don't have the testing. We still are vastly underestimating the number of people who currently have coronavirus. The numbers are probably much higher than what we're finding out right now. And so, first of all, we don't really know what's going on now. But I think we should also think about how we just can't measure our own counterfactual. I mean, the best case scenario is that we look back in months to come and say, oh, that's great that we implemented these measures just in time because not that many people died. But we also have to think about what is the cost of inaction. If we did not act now, what would it look like in our country and how many lives could we have saved?
Meg, what do you hear from the experts on this point about whether we're doing enough in terms of shutting the economy and places down and keeping people away from each other, and whether we did it in time?
The jury's out about whether we did it in time. Most people think that we could be doing more, that we need to make sure that people are really staying home, that rules and guidelines are extremely clear. They say it's bad when it's unclear about why you should be going outside or whether you should be around other people. So when it could be very clear that people should be staying inside, as Dr. Wen is making clear right now, they say that is really important. I haven't heard anybody say we're doing too much at this point. One thing that I have heard people say is a concern is that you just can't sustain this forever or for incredibly long periods of time. We are hearing from the government 15 days to slow the spread. And I do wonder, Dr. Wen, do you think 15 days is long enough? I mean, how long can we sustain this and how long do we need to make sure we really make a dent?
We just don't know. And it's really hard because we don't have real-time ability to measure what's going on now. But I also want to warn against chasing numbers because we should be looking ahead. What's been going on is that we've been reacting to what's happening, and it's not even an accurate picture, but we've been reacting to what's happening instead of anticipating what's ahead. So I don't think that 15 days is long enough, but I do think that we should reevaluate at 15 days and see what happens after that. Though, Meg, I agree with you completely that we are not doing enough. We have these restrictions in place for a reason, but I think people may not be taking it seriously, as in schools are closed, but parents are still getting kids together for play dates. That shouldn't happen. I mean, that completely negates the point of schools closing. So stay together as a family unit. don't go out. This is not a snow day. Don't treat it like it's a snow day. This is time for us to hunker down, recognizing that it's a major sacrifice and a major change, but it is what we have to do.
Dr. Wen, thank you for joining us.